Good afternoon, everyone. Hope your week is going great. My name is Sharonda Williams, the Communication Specialist for the National Center for Primary Care and Georgia High Tech. We would like to welcome you to our webinar, Medicaid Promoting Interoperability 2018 Attestation. Ready, set, go. We would love to connect with you. Can you please follow us on Twitter at GA-Hightech and visit our website at georgia-hightech.org. Georgia High Tech is Georgia's health IT center for assisting clinicians in the redesign of healthcare delivery through the successful adoption of EHR technology and interoperable systems. Our goal is to optimize patient information management for the successful transition to value-based clinical models and better health outcomes. We are located at the Morehouse School of Medicine National Center for Primary Care, where Ms. Carmen L. Hughes is our Executive Director and Dr. Dominique Mack is our Executive Medical Director. Without further ado, I am going to turn over this presentation to our two experienced speakers.
Good afternoon, everyone. Thank you for joining our webinar today. My name is Selena Williams. I'm the Program Manager in Techno Outreach for Georgia High Tech. Today, this webinar is specifically for Medicaid providers to assist with attestation, deadline February 28th. Our other speaker is Liz Hanson, Health IT Senior Specialist with Georgia High Tech. Our objectives today is review program year 2018 updates and changes, recap of the promoting interoperability requirements for Medicaid's modified stage 2, review of attestation documentation requirements, and overview of program year 2019 stage 3 requirements. Okay, our poll question for today is: have you already completed your program year 2018 Medicaid PI attestation? Okay, so for my feedback, it looks like no one has attested so far, and the deadline is February 28th, so please reach out to us for assistance so we can assist you with getting your application submitted. Okay, so program attestation, 28 payment year attestation deadline for eligible providers is February 28th. And of course, if you're not already in the program, it has closed. It closed in 2016. The program ends 12/31/2021. So you will be getting more information as to how that will go towards the end of the program. So let's get these applications, and there's no extension as of now, so the deadline is February 28th. Okay, reporting period for promoting interoperability, program year 2018. There's a minimum of 90 consecutive days for the dashboard reporting during the 2018 calendar year. And for the CQMs, it's 365. However, if you're already in the program, if you have not attested to meaningful use and are testing the first time to meaningful use promoting interoperability, you can use a 90-day CQM reporting period. However, if you're already in the program, you must submit 365 days CQM reporting to attest for program year 2018. EHR certification requirements for modified stage 2 is 2014 certification and or 2015 certification for program year 2018. You do have the option to attest to modified stage 2 or stage 3, or a combination of both. If you have 2015, you can attest to stage 3. For 2019, the 2015 certification will only be for stage 3 requirements. Method of attestation: no changes to the access method. You must go to the Georgia Medicaid EHR Incentive Program, MAPAS. Here's the website. You must have your registration ID and RNA number, and also your certification number. You must have your username and password to enter into the MAPA system. And it's very important. I know they mentioned that you don't need the verification of use letter, but it is very important that you do have that letter handy, because you will need your certification number to enter, to get past that point to enter into your application process. So if you do not have that information, please reach out to your EHR vendor and have that handy when you're ready to submit your application. Okay, modified stage 2 objectives and measures. Here's a brief overview of a snippet of the requirements and thresholds that are needed for modified stage 2 objectives for program year 18. Liz is going to go into some tips and strategies to help you meet these thresholds. So I'm going to turn it over to Liz Hanson.
Thank you, Selena. I think we skipped over the slide on the CQMs. I think that you had probably gone ahead and covered most of this, but the CQMs, there are less CQMs this year as there were in 2017, and you don't have any of the domains that you need to worry about, but you do need to report on the 6, and for most of you, that will be in a 365-day reporting period. We do want to point out that before you get ready to go on and attest, make sure that you have the identifying numbers, either the CQM or the NQF number for each of your quality measures. You will have to sort through those and put a check mark by them before you can enter the data. And so it gets a little awkward when you start looking for what those quality numbers are. Some of your EHRs only have a description, and you need to look those up to make sure you have the numbers, because it's very difficult to do it looking up based on descriptions, and very easy if you're using the numbers. So I'm just going to briefly look at and talk about each of these measures. You've already, oh, sorry about that. Got ahead of myself. I did want to point out that this year, as last year, there are the additional attestation questions that you will have to go through when you first go into your modified stage 2 objective screens and you're ready to put in your data for your promoting interoperability measures. Then you're going to have to first go in and edit on these first set of questions that have to do around not blocking the information, the exchange of information, and allowing the ONC to provide surveillance and not refusing any request to do so. So these are nothing to be concerned about. You just want to read through them and answer them honestly. So typically you're going to answer, you would answer yes, that you will not, yes, you're not going to block, and yes, the ONC can come in and take a look. But there are some additional questions around, have you been asked for that to occur? So it may not be all yeses in that case. So this is another screen that gives you the rest of these. It's a little intimidating because it's a full page of questions, but the questions aren't bad. You just need to read through them. Now we're going to take a little time and go through each of these objectives. Again, you should have already accomplished these objectives. Some of you are having a few issues with your reports on some of the objectives, and your EHR companies can make some adjustments for how the report is running, but it has to apply and been applied in the 2018 time period. And of course, the first thing, and the one we talk a great deal about, is make sure that you have your security risk assessment. This is a document you wanted completed. You had to complete it by the end of 2018, and now you're ready to work on 2019. But for that document for 2018, you must make sure you've got a mitigation plan in any areas that you're at risk, and that you have dates when you'd like to accomplish mitigating those issues. And you need to plan to do that within the next few months. You don't want to plan something a year off to be fixed. You want to plan to complete the mitigation within the next couple of months. You might not get it done, but you at least want to plan to. So the security risk assessment definitely ought to be put aside in a file folder, perhaps on your system or in the cloud or both places, because this is something that is asked for on an audit, and apparently they're easy to lose from year to year. So please hold on to this for 6 years, just like you would your promoting interoperability report. And that's the report where you're going to see some of the measures that now come up. Now, some of your systems will show clinical decision support rules with a yes or no. Some of them will not, and you'll have to manually enter that. So your clinical decision support rules are those alerts or those protocols built in within your system to remind you to do certain clinical activities, and you have to report on, you have to make sure that you have screenshots of at least 5 of those that are reflected in your quality measures. So for instance, you may have an alert that pops up and says screen for smoking, and that would go with the quality measure for tobacco screening. You may have one that pops up for females over the age of 40, and it may screen for mammogram, and then that would go with the quality measure for screening for breast cancer. So these have given many of our practices a little bit of difficulty because you're not sure exactly where these alerts reside. It is different from system to system, called something different from different systems frequently. So we'd be glad to help you out with this. Please note that drug allergy is a requirement, and you do need a screenshot of it, but it's not a clinical decision support rule, and that does not count. Well, it is, but it doesn't count as one of your 5. So please make sure you got those screenshots. And if you're going to attest in 2019 and you've already gotten your upgrades, go ahead and take those now. Please don't wait till next December to work on these screenshots for 2019, because we've passed the time when you should have already had them. The next section talks about our computerized physician order entry. This is one you guys have been doing for a long time, most of you. Of course, there are some exemptions if you have less than 100 medication orders, and that is at 60%. And again, most of you have a pretty easy time achieving this one. The next one has to do with lab orders, and as long as you are connected or you do labs, we do have some specialties that don't do labs, then over 30% is pretty easy to accomplish. I do want to remind you that for these measures, the requirement is greater than the threshold, more than the threshold. If you're right on the threshold at 30%, that is not passing. So I have to remind you from that from time to time, especially on some of these upcoming measures. Now, the next one is the radiology orders. And again, it's at greater than 30%, and there is an exemption for this. Don't think any of you are having any problems with this particular measure. E-prescribing. Now, actually, we have seen some problems on some reports for 2018 with e-prescribing. And these typically had to do with the fact that the formulary box was not checked. And that is a requirement. So please, if you're having any difficulty or this one looks a little lower than it should be, of course, there is a threshold that you have to meet. But if it's lower than it should be and you don't know why, please check to make sure there's not a problem with checking that box of the formulary, because we are finding that coming up quite frequently, actually. Now, the next measure that we're going to take a look at, before we do, we want to ask the question if you're having problems with health information exchange meeting that threshold. So if you would, please let us know that yes, you're having issues, no, you're not having issues, or it doesn't apply to you. Okay, I'm glad to see some folks are not having issues. Maybe we should get you guys connected with the ones that are having issues. Folks, this particular measure is going to get easier and easier as we go. So some of you are still having issues. We are finding that to be the case with over 50% of our practices. And I think it's time that you go back to being proactive with this one. Even if you checked with practices a half a year ago, it's time to check back in and see if they're now using direct and you can exchange information with them. Because in 2019, this measure gets a little more sophisticated. So we got to meet this health information exchange measurement. It is very critical. It is the transport method for interoperability. So we really, really need to be able to do this one. And the sooner you get this working with more practices, the more practices that will be able to do it, and it will grow organically. So please, if you're having some issues with this, let us give you some advice and some help, because we need to make this one happen now. If you didn't meet this threshold for 2018 and you had less than 100, had more than 100 prescriptions, and had more than 100 referrals to other practices, you will not pass your attestation. So patient education. This measure has actually given several practices problems in the last few months, and I believe the reason for this is that the practices receive the upgrade, which changes the requirement for patient education. And if you already received the upgrade, what we're trying to meet this modified stage 2 objectives, you're actually meeting a different objective that requires your patient education to be uploaded onto the portal. So if that happened to you, you might need to back up and use a report that hopefully you're meeting all your measures that occurred before the upgrade and this change to your patient education tracking if you're not meeting this measure. I've seen several practices where this happened to you, and so we just need to back it up and see if you're meeting the measures before it was tracking the new way, because that is a difference. We'll have to experience it in 2019, but not for 2018. Medication reconciliation. This is one of those measures that only tracks new patients or patients being referred in. And most of you are doing a pretty good job with medication reconciliation. This actually expands in 2019. So you want to make sure you've got a good handle on it. If your practice isn't doing it, but you know how to do it, it's just an extra button to click. Please encourage your practices to start clicking that button. The next one, patient access. Here we're leading the horse to water. Most of you have gotten pretty good with this measure. This is the measure that typically tracks through your EHR when you get the patient's email address. On some of your systems, it's when you send the email invitation. What we've found, even in the last 4 months, is some practices don't know quite how this is tracking, and you need to get a handle on this. Most of you are doing pretty good. You're over 50%. And it's actually this next one of view, download, and transmit that has been a problem. Now, this is an area where we do have some ideas of how you can improve view, download, and transmit. It is a very small percentage, just over 5%. And this one takes some effort typically. So if you have some issues with this in 2019, we'd love to help you see if we can make this easier for you. If you did meet this in 2018, you will not pass your attestation. Secure electronic messaging. This one is not so hard to do. It's just sometimes tedious. So this is where you respond to a patient or send a patient a secure message. It may be in regards to a clinical question. It may be in regards to prescription refill. It may be an announcement coming from the provider out to patients about dates when the practice will be open, or that it's time for flu shot, or some general health piece of health information. But this is something that everybody has the capability of doing. It's just maybe a little pain, so you just need to do it. And then we have the public health registries, and these have been an issue for several years for us, and it's more confusing than it really is hard. So we're just going to try to map it out so you know what it is that you need to do, and you can attest the way that you need to. Now, you do have to attest to either meeting 2 registries or participating in 1 registry and exempting from 2 registries or exempting from 3 registries. You do have to attempt to participate in a registry that pertains to your practice, but you do not have to go overboard in this attempt. And we're just going to go through these because it's time to get that registry information done again. And you want to make sure you have the right documentation to upload for 2018. So your registration data should be applied for or being utilized within the first 60 days of your reporting period. So what this means is if you were going to apply for the syndromic surveillance exemption, and your reporting term is going to be October 1st to December 29th, then by the end of November, you should have already gotten that form within the first 60 days of your reporting period. Now, many of you don't know exactly what your reporting period is going to be for 2019, so go ahead and get this done now. For 2018, some of you did get a little later than you should have, and we hope that that will be accepted. Now, if you are already utilizing immunization, the GRITS registry, then you can just do a screenshot of the download or the upload, if you will, or some portion of your EHR where it shows that that's occurring. And so there's different proof that you will use depending on the registry that you have. Again, do it now, and hopefully you already did it for 2018 in the first 60 days. So we have immunization registry, syndromic surveillance, and a specialized registry reporting. The immunization registry is the one that most of you are familiar with, and typically you will either be participating in the registry or you'll be setting up to be participating in the registry. There are exclusions. There is an exclusion if you do not give any immunizations, and then you would type up just a letter that you would upload to the attestation site that says that you don't provide any immunizations, and that would include flu and pneumonia, any immunizations or any immunizations. Or you may be in an area that doesn't have access to grits. This is very, very rare in Georgia. So either you're participating or you don't give immunizations are typically the two that you would use in the state of Georgia. And we'll be glad to help you with this if you need some additional advice. And if you're participating, you would get a screenshot. Most of you have already gone through the process of participating in the registry. Please note that if you don't have it fully implemented, but you are in the process of onboarding or participating, then that counts. And you have an option to check that box. So we do want to take advantage of that if you're in the onboarding process, but it's not in full production mode. The next one is syndromic surveillance. Syndromic surveillance is available in the state of Georgia for hospitals and I believe critical access centers. It is not available for EPs. So you could check the last box for this one. So it would be no, 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 yes. But in the process of saying no to syndromic surveillance, you need to have proof that it wasn't available. You can go to the DPH site, you can go to the meaningful use page, and from there you can click to complete a survey. And it just says click here. You can click to complete the survey. Make sure that you fill out the dark pink sections and make sure that you fill out eligible provider on line number 8. And then on line number 19, you want to make sure you check syndromic surveillance. And then you can submit. Once you submit this, you will get a final page, and it has a tracking number in the upper right-hand corner. So you want to make sure you get a screenshot or you print out and save that particular screen because it shows that you have submitted. You should get an email telling you that it's not available, but not all of you always get the email. So this is just a double check to make sure you've got it. And these are the documents you will upload when you attest. You will upload the letter you got and that submission screen. Preferably the letter. If you don't have the letter, upload the submission screen. Our next section talks about specialized registries, and you may or may not have a specialized registries that you participate in. Many of you will choose that there is no specialized registry available for your specialty, or there's none in your jurisdiction. Now, there are some in the state of Georgia, but you have to do some due diligence. You need to see what's available in the state, and we'll talk about that just a second. Then that's in addition to grits and syndromic surveillance. And then there may be a registry available through your professional society, or your professional society may not have one, and they can send you a letter, or it's available on their website. I know that ACOG has a notice on their website that you can do a screenshot and utilize. I know that there is an individual with the Pediatric Association that you can email, and she will send you an email telling you that there's not a registry for the Pediatric Association. Some of your specialties will have a registry available, most will not. You just have to inquire and find out and then get proof if there is not. These are the FAQs. They are old, but they are existing FAQs that say that you just have to attempt to see if there's a registry specific to you. So I wanted to make sure that you're able to do that. That you have, and want to make sure that you have that documentation for 2018 and that you're already working on it for 2019. PY-2018, and that you're keeping this documentation for 6 years. I know y'all are so tired of hearing about registries from me. This is just some additional reinforcement. Now, there is a Georgia Cancer Registry available, and you may want, if you're in dermatology, urology, hematology, oncology, or gastroenterology, you may want to inquire to see if the cancer registry is appropriate for you. If not, then this may be an area you need to continue to take an exemption, but continue to check every year. So now we're going to look at the attestation checklist, and I believe Selena is going to take us back to.
Thank you so much, Liz, for that wonderful detailed presentation. So we're going to go over the attestation checklist. As I mentioned before, make sure you have your registration ID or RNA number. If you do not have this number, you would need to sign into the EHR and send it CMS Gov, the PICO system, to get access of this number. And just a little advice, I had a provider that did not have it because, leadership changes and, sometimes the information changes and you have to get your own login information. So it took quite some time, like over a month, for her to get that information from CMS. She had to go back and forth. So it's very important that you reach out to them and get access to this information so you're not held up when it's time to go into MAPR and do your application. Okay, no single file can be greater than 4 megabytes. When you upload your documentation for your screenshots and your other documentation required, you may need to split up some of the documentation, especially the detail and counter reports. That should be in Excel format or PDF, and you may need to convert the PVC and SRA to that as well. So the patient volume calculator, as you know, you can use 90 consecutive days, and it can be the previous year. For example, we're in program year 2018, so you can use any consecutive 90 days for 2017 to upload for your attestation. Your detail and counter report, because of the file size, you may need to separate these, the Medicaid. So as I mentioned, you do this in a spreadsheet and separate it by the provider and the payers and the other pertinent information that's listed here. Your security risk analysis, as Liz mentioned, at this point it should have been done already because it has to be done within the attestation year 2018 with the mitigation plan dates for mitigation and saved as program year 2018 as an Excel or PDF. You must have your certification number. The verification of use letter is not needed, but it's still good to get that information. If you can get it from your EHR vendor, it will have that certification number. You will need that to enter into the MAPR application. Your meaningful use dashboard report, that is a consecutive 90 days. In 2018, you must pass all objectives and measures. It is very important because if you, it's either all or none. And that's also if you're testing as a group. If the providers are testing as a group, each provider must pass each of those objectives and measures. And so you must upload that report along with your CQM report. As I mentioned, 90 days for providers who are testing for the first time for meaningful use promoting interoperability, or full year for providers who have already attested to promoting interoperability. Your yes or no screenshots, those should have been done already too within the attestation period because it is time sensitive. So make sure you have those. You must have 5 clinical decision support rules that relate to the clinical quality measures. Your drug to drug allergy interaction check, that must be enabled. So you must also have a screenshot of that as well. And proof of any of your active registries saved as a PDF, and documentation for all of your inclusions on your letterhead. Exemption, and as they mentioned, I think maybe 2019, there may be some changes as far as the syndromic surveillance. But as of now, you still have to get that letter from the registry, send an email. I have that link if you need that where you can send that and request that letter, and they would send something back to you saying that it's not required, and that should be acceptable and MAPR, that you don't have to attest to the syndromic surveillance. Okay, so here's a few attestation tips. Have a copy of your 90-day Promoting Interoperability and CQM report available, printed or on another screen. Create a folder on your desktop for program year 18, and as Liz mentioned, you must keep this information for 6 years for all your files to be uploaded in case for audit purposes. We hope no one gets audited, but just in case, make sure you have this documentation available because they will request this documentation. So it is very important that you keep this information in a designated file that you can get access to if needed. Make sure all your documents are legible. Run a report of your encounters during PI reporting period versus encounters in the EHR system. Put your exclusion letters on letterhead. Know your CQM, identifying CQMs or NQF numbers. Do not submit until you have all the required documents uploaded. So that's very important. So when you get ready to attest, just make sure you have all your documentation. I've been sending out a checklist to all of my providers that I'm working with personally, because if you don't have all the documentation, it's going to slow down the process of your application. And it's very important once you submit your application that you go into MAPR and pay attention to the notes that the MAPR representatives that are processing the applications, they go in once you submit your applications, they go in and they give you notes and feedback if they're requesting documentation. And we've had that problem where people are not, providers are not going back reading that information. So it's very important that you read the notes, the feedback they're giving you, whatever they're requesting, and turn that into them, because it is time sensitive. You may get into close to the attestation period and they may not accept it. So just make sure once you submit your application that you are following up on the notes and documentations that are being requested from the representatives that are processing your application. Okay, so I'm gonna turn this back over to Liz. She's going to go into some more attestation tips and the stage 3 requirements.
We just have up on the screen right now a screenshot of the area that you discussed about run a report so you know how many encounters you had during your attestation period. That's your 90-day Promoting Interoperability period, because we see early on when we go into a test for Promoting Interoperability, it asks us if at least 50% of our encounters during that time in a location were on your cert. And most of you, if not all of you, this is absolutely 100%, but most of you don't have a count for how many encounters. You have a count for how many patients you saw during that period, because that's the denominator on several of your measures, but you don't have a count for how many encounters. So just go ahead and run a report for how many encounters you had for the same time period that your Promoting Interoperability attestation reporting period runs, and then you'll have that number, and that will be easy. So now we need to go to our 2019 attestation. I'm trying to decide if we should, and then we'll circle back and catch up on a couple of these questions that have come in. So I want to make sure that you do start preparing. We want you to go ahead and get 2018 done, and we'd love to help you if you could use some help, but we got to start getting ready for 2019. So you need to make sure that you are seeing your reports and managing your measures and your thresholds. The measures are changing, so you're going to have to pay some close attention for the next few weeks and make sure you're on track with your measures. You want to make sure you go ahead and get your registries done, get started on that security risk assessment. Go ahead and get those clinical decision support rule screenshots if you have your upgrade. If you don't have your upgrade, and we'll talk about this when we come into a future session strictly on 2019, but you want to make sure you're taking those screenshots with the upgrade that you're going to be attesting with. So you could take them now, but if you don't have your 2015 cert, you're going to have to come back and retake those. And then, of course, you could go ahead and work on that patient volume calculator if you're using the previous year. You may not have a current calculator, but the way it calculates, you could still go ahead and put together your detailed encounter reports. And we do encourage you to start on this just as soon as you get the other done. So we do want to take a look at the 2019 measures pretty briefly. We want to make sure we've got time for some questions. So just going to go over these. And the first thing we want to say is that you have to have 2015 certification. Now, there's some flexibility about when that has to have occur. You have to be using that 2015 certification system. You have to be using the system by October 3rd. It has to be certified by the end of the year. So that's a little bit tricky. Let's just all say we want certified systems in-house and using them by October 1st, and then we'll all be pretty good. We still have to make some adjustments, though, so I'm hoping the sooner the better. Now, you'll notice that number one objective is still the security risk assessment with mitigation plan and dates. You've been doing that. Let's do it again and go ahead and do it early. Let's try to make this 2019 the year that we're not doing security risk assessments on New Year's Eve. Haven't found one of those yet. E-prescribing, this is something you've been doing, but it is now greater than 60 as the threshold. There is an exemption. Not many of you will fall below that exemption level. You do have to be using drug formulary. Go ahead and make sure that's working for you, folks. Don't wait. The next area is clinical decision support rules. There will be 5 clinical decision support rules that are required, and they must match at least 4 CQMs. If they're not relevant to 4, then you have to have 5 rules that are relevant to 5 CQMs. So go ahead and you have to have screenshots to prove those. They should apply to your practice, the workflows within your practice, the clinical work being done within your practice and your specialty, or high priority health conditions. So we're being a little more specific with what we want these quality measures to be about, because we'd like for them to help improve quality within the practice. Trying to reach some goals here. The next one, number 3, drug allergy interaction. You want to get a screenshot of this. You want to make sure it's enabled and implemented just like it was for 2018. CPOE, those are the same that you've seen before. Your thresholds are now all greater than 60. To continue these measures, timely access, that's our patient portal. It has to be turned on or given. The access has to be provided within 48 hours, and specific health information has to be uploaded to it or made available through it. Opt-outs can be counted under specific conditions, and some of you may need to use those, but the timely access has changed slightly, and so again, we want to see if that's tracking for you. So as soon as you get that upgrade and can see those stage 3 measures, let's see if this is working or if we need to make some adjustments. Number 5, 1B, as we call it, is access through an API. And this is something that will be made available through your EHR with your 2015 cert. Haven't actually seen this manifested yet. I'm thinking it's going to be a yes/no, but I haven't seen it yet, so I'll let you know when I do, but it has to be enabled. Patient education is a requirement that now falls under patient electronic access. The reason for this is the patient education has to be uploaded into the portal for patient access to be counted. So it must be available on the portal. You'll notice portal access 5.1a is now greater than 80%. Greater than 80%. So some of you do have some work to do. I didn't mean to skip over that. Patient education is now greater than 35%. And notice that you can attest to 3 and exceed 2 thresholds. So if there is a threshold associated with 1B, so it has a numerator and denominator, and you don't meet it, then you could do 1A and 2. So you've got some flexibility in meeting these. But again, folks, until we see your report, I won't know. We won't know. The other thing we want to let you know is that there is a data set. When we talk about what has to be available, that specific health information that has to be available, there is a specific set of data that has to be available for it to track for number 5, 1A or 2. So, wow. So that's a good bit different. I think I actually said that wrong. Let me just restate it. You have to do 1A and you have to meet 2. 1B, I believe, is going to be a yes/no. Care coordination, please forgive me. Care coordination is where you get some flexibility to choose. So now we have view, download, and transmit. The bane of our existence now falls under care coordination. And it can't be the bane of our existence anymore because we need our patients to do it. And practices that are having this used are saying it saves them time. Saves them time. So view, download, and transmit greater than 5%, or they have to have access through the API where it's automatic. And the API access folks might give them the ability to, for instance, upload Fitbit data, for example, or to upload data automatically from an application or device that your patient has. We're going to hold off on any more discussion about that for now. Secure messaging through the portal greater than 5%. Patient-generated health data greater than 5%. Now, patient-generated health data could come in many forms. And remember, we have to meet the thresholds on 2 of 3 of these in number 6. Patient-generated health data, when we first heard about this several years ago, maybe 9 years ago in its infancy, but at least 7 years ago, we were talking about feeding Fitbit data, and then feeding iWatch data, and then just feeding general data from perhaps you have an application at home where the provider or the patient can record their weight, or it records their weight or their blood pressure, and this data can be automatically uploaded into your EHR. That is generated health data. Some patient-generated health data takes the form of a form where a patient fills out some information, uploads that into the portal. That's generated health data. So it does take multiple forms. This is a new measure. We're just going to have to work on this. I have to tell you, I have seen several of you that actually have this one working. And congratulations to you. It's not as bad as it seems. Now, health information exchange, that's the one we really need to get up. And for 2019, it includes creating and electronically sending a summary of care for referrals, receiving a summary of care when you have a patient referred to you, and clinical information reconciliation. And this is where med reconciliation is performed, med allergy reconciliation is performed, and current problem list. Now, the intent of this measure is that you will receive a summary of care document and you will upload it into your EHR, and the data will be consumed and automatically populated. And that is interoperability. Might take us a little time to work through this one, folks. The good news is you have to attest to all 3, but exceed 2 thresholds. You want to have at least a 1 in there, but you only have to exceed 2 of the 3. So clinical information, I think, is going to be fairly easy. I think some of us will have a challenge with continuing to get providers we can exchange with, but there'll be more of you now that need to do it, so it should be easier in 2019. We just have to work on it. So that was a lot of information. We will note that at this present time, quality measures still have to be reported for 365 days in 2019, and that you still will have to do 2 participations in registries, or 1 yes and 2 exclusions, or 3 exclusions. Whew, that was kind of a lot. All right. So, Selena, I'll let it go back to you, and then we'll tack on some questions.
Okay, so I'll just briefly explain this little infographic. It kind of ties into what Liz was stating regarding in modified stage 2, of course, objective 5, and in stage 3, it's going to be objective 7. So this piece is very critical to interoperability. And so this little infographic is kind of telling you to get connected with other providers, your labs, your pharmacies, your public health, being able to exchange data to promote interoperability. So this is another piece of some of the resources we offer here at Georgia High Tech, and also GHIN offers Georgia Direct, which is no cost to your practice, to help meet those objectives. And there are funds as far as Georgia Health Connect that will offset some of the costs if you're interested in getting connected. And what happens if you connect with us, Georgia Health Connect, we're connected with GHAN, which is a regional HIE, and you can connect with some of the bigger facilities like Choa and Grady and exchange data and information with them. So as she mentioned, this is very critical. The threshold is very high. So what we would like to see is providers get connected. The resources is out there. Funds are out there to offset some of the costs. So reach out to us, reach out to me, reach out to any of our field representatives. So it's all about promoting interoperability and making data exchange a little easier to make medical decisions. So I guess we'll go to take a few questions now, Liz.
Okay, so I thought we might go through the ones that are already in our question box. Some of these came over from registration, and then see if anyone else has any questions. If you would enter those into the chat box, and we'll go through those next, given time. So we did have a question originally about what is CERT's impact, or what is the impact of your certification of your EHR. And you have to use either a 2014 or a 2015 certification for 2018 attestation. In 2019, you must have a 2015 certification. So there is an impact for your certification. If you have either 2014 or 2015, then you can use either of those to attest, and you will be good. So the next question is, how can you overcome the difficulty of patients using the portal? Well, this is a great question, and we've been working on this one for several years. And it does take patience and persistence. So we're just going to give you a couple of ideas, but if you want to just address this individually, then we'll be glad to contact you and see if we can give you some very specific examples. Some of the ways that we have found to encourage patient participation is, first of all, make sure that your portal is working and folks can access it easily, because we have seen that the difficulty lies in accessing the portal. And if they have to get a password reset every time they access it, you might want to rethink that. So we want you to make sure your process is as easy as it can possibly be for the patients to access. The second thing we want to make sure you do is that you know and your staff know how to use it, that you've been on the portal, that you can move around in it, you understand how it works, so that you understand some of the benefits to share with your patients. You might put together a little benefit sheet and make sure it's got just a few things on it, maybe a couple graphics, and the benefits loud and clear, and then follow through with those benefits. They should be able to see some of their health data. Maybe you're putting up their normal lab reports. Maybe you're putting up their BMI, their blood pressure, some of their general health data is up on that site, available to them. Patient education, let them know that you're putting patient education up on that site. Let them know that you're putting announcements or information that's pertinent to their health care up on that site. Give them a reason to get on the site. And when I say give them a reason, not a $5 gift card. Give them a long-term reason and some benefit to go in and see what their medications are that they're taking. So those are the easy, the simple things to start doing. The biggest impact could come if you're a provider or all clinical employees mention it to the patient and ask them to get on the portal. So the front desk should be reminding them and maybe giving them a handout. Make sure the directions are easy and on the handout. And then the clinical person, when they walk them to the room, should remind them. If you could get the provider to write it on a script pad and tear it off and hand it to them, it will have an impact. Eventually, folks, patients won't go to a provider that doesn't have a portal, but we're still in the transition stage. Now, if any of those things don't work, we have some other ideas about encouragement. But one of the other things we've seen to have a major difference, but does make a little change to the practice, is to hire an intern or a student who wants to get some class credit or work for a very low fee to get some hours in every week, to come in for a few hours every week, make sure they're HIPAA trained, signed, sealed, and delivered on the non-disclosure confidentiality agreement, and understand they can't get on social media. but actually have them sit in a closet or somewhere separate and actually get folks go in and get them a Gmail account and get them logged in and have them view, download, and transmit. And have them do that while the patients come in and are in the waiting room to see the patient, see the provider. It does have to be confidential, but it could be accomplished within 15 minutes. If they've already got an email, it should be able to be accomplished in 5 minutes. This can greatly impact. It's not a good way to get from 20 to 80, but it's a good way to get over 5% of you download and transmit, and it is a good way to add 10 to 20% more patients onto the portal. So those are just a few ways. We have some other ideas. We'd love to talk to you individually and talk about how some of those ideas. If you have some ideas in your practice that are working, please let us know about them because we'll share them. And a lot of folks need some help with this one. The next question says, this is my first time reporting. Do you have any tips for someone like me in addition to technical advice? Well, we got lots of tips, but my biggest tip for you is please give us your contact information and let us get in contact with you. The first thing we'll want to do is take a look at your reports and see how you're doing on your promoting interoperability measures. And then we'll start talking about whether you meet the promoting interoperability, the patient volume calculator data. If you're trying to get it done for 2018, let us help you now. And as we work through 2018, you'll begin to learn what to do for 2019. The next question says they have barriers for attesting as a specialty behavioral health provider and wants to know if there's any information around this. This feels like it may be a MIPS question rather than a Medicaid question. But if you are using barriers as a registry for Medicaid, then that should be acceptable, and we would just want to make sure. I would personally want to double check the list to make sure they're listed as a certified registry. I believe they are, and I would want to make sure that you have proof that you're using it if it's for the Medicaid incentive program. And those are all the questions that I see. Did any of y'all have any other questions, or folks on the line, did you want to put any more questions?
Selena, did you have anything to add to any of the questions?
Yes, I was just going to add to the question, the one that's stating that it's her first time. And as Liz mentioned, reach out to us. We can assist you. But just to give a few tips, as far as it is the beginning of the year, so if you start now by pulling your Meaningful Use dashboard, check it every 2 weeks if you can. If not, at least once a month, and set up a workflow with your clinicians and your staff. And that way, if you're having any problems along the way, you can rectify it in the beginning, address it with your staff or your EHR vendor. And that's just my most important tip, as speaking from experience. Because once you, as the year passes, time passes, and there's a problem within meeting some of the objectives and measures, and with the thresholds being so high, especially for 2019, you want to just start tackling that now. With pulling that PI dashboard and checking it at least twice a month. I know it gets busy as a practice manager, but that's very important to pull that dashboard to assure that all the measures are being tracked in your EHR system, and to determine whether it's an issue with your staff or a technical issue with your EHR vendor.
Great. Thank you so much. And this was a very interesting and informative presentation today. We did want to announce our next upcoming webinar, Dot Your I's and Cross Your T's, Do Your SRA Please. It is going to be Tuesday, February 19th at 12 o'clock p.m., our same time. We ask that when we send out for registration, register for our webinars. That way you can be caught up with all of the information we have, any events and everything like that, and we can see what type of products and information you all want to see more, because we open it up where you can actually give us some information, some suggestions, and everything like that. So please register for our webinars. And here are some resources and information that you can find on our website as well. All of our materials from our webinar will be found on the website at a later date. And if you have any additional questions, please feel free to email us. We want to thank you so much for joining us for our webinar today. We want to thank our speakers. They did a great job, and we hope you all have a great week.